Just a quickie about keeping your boob where it naturally sits. So this is something that can cause real breast pain and real problems with latching and various things. And often what it comes down to is that the breast is being moved into a sort of unnatural position where it wants to be. So it might be that, you know, you're getting the baby on, sort of lifting the boob up over to the baby, putting the baby on, and everything's okay, but then actually you're either stuck with your boob in an unnatural position like that, or when you let it go, it all just doesn't, you know, slips apart, or the baby stays latched, but the breast is kind of dragging, and that skin tissue's dragging, and the nipple's getting damaged and various things. So rather than cupping and holding the boob and lifting it over, to avoid the temptation of doing that, I really quite like using kind of just finger stabilizing technique, I suppose I'll call it. Yeah, let's call it that. Finger stabilizing technique. So you're getting the baby on, baby's tucked in nice and tightly to you, got nothing on the back of their head, their chest's in really tight, arms either side of the boob, like that. Rather than using your hand, just stick a couple of fingers just on the edge there, probably around the edge of your areola, inch or so back from the edge of your nipple, and just, if you need to feel, you need to stabilise the breast a little bit, and you can just push in slightly just to angle the nipple ever so slightly in the direction you want it to go, so that it's going to be kind of going out the back of their head when they open their mouth. Just hold slightly, press in, baby opens wide, woof, you can wallop them on, and you can just nudge the nipple in ever so slightly at the same time, which can be really useful. And that way the breast is sitting where it naturally wants to sit and where it wants to rest, and it's not all going to kind of drag or fall apart or anything. So if your boob's up here, have your baby up here. Don't move the boob around. If your boob sits down here, have the baby down here. Don't move the boob around. Just, you know, try not to lift it up and over. Just use a couple of fingers on the side to just angle. Pop baby on. Lovely. Bring that arm round. Comfy.